Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. The 5-day-long Lunar New Year holiday, or Seollal as it's known in Korea, came to an end on Wednesday. Now, despite health authorities really urging the public here in South Korea to avoid travelling if possible because of COVID-19, didn't stop millions of office workers visiting their hometowns. Anyway, as we just heard from our Chairman Jung, on Wednesday, South Korea confirmed over 20,000 new infections for the first time in a single day, expecting similar numbers on Thursday, as well as Omicron continues to rip across the country.
And despite the explosion in new cases, the number of deaths and critically ill has been on a downtrend as Omicron has become the dominant strain, replacing the much more potent Delta strain. For more, we connect to Dr. Alice Tan, internist at MizMedi Women's Hospital in Seoul. Good morning, Dr. Tan. Hope you had a nice holiday.
Thank you. Good morning.
Well, let's start by getting your reaction on what Mark just mentioned. South Korea reporting more than 20,000 cases on Wednesday. And also, do experts expect this figure to grow exponentially like other countries did?
Well, there's every indication right now that the number of cases will continue to rise. The reason why I say this is because the reproductive rate, the effective reproductive rate is 1.58. Any number above 1 indicates that the infections are spreading. Also, test positivity rose above 7%. And what this means is there are many more positive cases in the community that are simply not being detected by testing right now. We want test positivity to be less than 2%. If we look at what happened in the UK, South Africa, other countries that started the Omicron wave before us, it took them about 4 to 5 weeks to peak in terms of their Omicron wave. South Korea's wave started about 3 weeks ago, and so it looks like we may have a few more weeks before we peak in our wave. There has been some attenuation, I think, in the rate of rise of our peak because of the holidays, and also because we have a very high, relatively very high booster administration rate. If we look at what's going on in Japan, surprisingly, their booster rate for their total population is actually less than 5%. So I think even though they have a very high full vaccination rate, what we know is full vaccination is not enough to protect against infection with Omicron. And so our, I think, booster rate, which is now over 50% for the full population, is what's dampening the rate of rise in our country.
Yeah, it's rather shocking to think that Japan is such an advanced country, but yet they are still so low in terms of booster shots. And even now in South Korea at the current time, even much younger people are still getting booster shots. But a lot of people watching will be wondering, maybe a little bit concerned, if they've received both COVID-19 vaccinations and have had the booster shot, because these were all prepared when we had the other strains before. Can they still contract Omicron? And also, right now we have close to 800,000 people who have contracted COVID in one form or another and gone on to recover. Can they also catch Omicron?
What's clear with Omicron is that this variant, because of its high number of mutations, is really eroding both natural infection-induced immunity and also immunity from vaccines. But the good news is this. If you have received a booster shot, then your chances of getting infected are much lower. And also, with just full vaccination, so 2 doses of a vaccine, your chances of being hospitalized, developing severe disease, having a ICU admission due to COVID-19, these chances are much lower, even with Omicron. So people get confused because there are different levels of vaccine effectiveness. Does the vaccine protect against just infection, or does it protect against also hospitalization and severe disease? And what's clear is our vaccines still do work in terms of protecting against the development of severe disease. In terms of natural infection, a study out of England showed that prior infection due to previous strains of the COVID virus, they used to offer about 85% protection against reinfection, but with Omicron, that has changed. Protection has now gone down to 19%. So people who have had COVID-19 in the past, unless they've been vaccinated, they can consider that their immunity levels have pretty much worn off.
Now, Dr. Tan, the Beijing Winter Olympics are about to start, and I want to ask, what is your take on the unprecedented virus safety protocols there? And on a side note, Paris 2024, do you think the Games would look a little bit more normal?
Well, I'm hoping Paris 2024 will look completely normal and we'll be able to have an Olympics with international spectators and all of the celebration and fun that goes along with the Olympic Games. I was fortunately able to participate in the Pyeongchang Olympics here in Korea in 2018, and I know it's supposed to be a celebration. It's supposed to be a gathering and a fun event, and certainly COVID has made it much harder to gather and celebrate. Now, if we look at what happened in Tokyo, they had a similar bubble system going on with their Olympics over the summer. And all in all, it was a fairly successful games in terms of preventing spread of COVID-19 within the bubble. So the bubble for athletes and for all stakeholders. I think there were only 33 infections among 11,300 athletes, and less than 500 infections among all stakeholders, despite tens of thousands of participants. The closed loop system in Beijing will be much more strict. Basically, you have to do a 21-day quarantine if you have not been fully vaccinated. And then all eating, sleeping, training, competing will happen within a limited closed loop. There will be very, very limited interaction between athletes and stakeholders and the public. And so I do think that it will be a safe games. My concern, though, is their definition of full vaccination seems to be just 2 doses of a vaccine. They are not requiring booster shots. And as I just said, 2 doses of a vaccine are not enough to protect against infection with Omicron. So they will be testing all participants on a daily basis. Hopefully that will be enough to prevent big outbreaks of COVID-19.
Yeah, well, I suppose needs must, but you can't help but feel kind of sorry for the athletes, especially the young men and women who've spent their whole lives training, and then when they finally get to the Olympics, they're kind of almost living in a temporary prison cell for the course of the 3 weeks or so, when they should be having fun outside of their activities. As always, Doctor, unfortunately we're out of time, but we appreciate your insights and we look forward to speaking to you again soon. Thank you.
Thank you.